So the battle lasted more than a year. Now, at long last, some big changes in health care are finally going to come into effect. What will they be exactly, and how will they help you? Two big questions here. Josh is here with a breakdown. Josh, morning.
Yeah, good morning to you, Tony. Today marks 6 months, or actually it's September 23rd, so it'll be tomorrow, will mark the 6-month mark since the president actually signed that legislation, and it is the date that some of these big changes actually come into effect. It's always interesting to see the length of time between the battles that go on and when it actually impacts you. The first thing to tell you is that most people get insurance through work and actually won't see changes in your health plan until it renews, and that's usually January 1st. But for plans that are sold to new individuals or groups starting tomorrow, the changes could be there right away. So let's take a look at a few of the changes I have on you for my screen right here. The first one I'm going to show you is this: dependent coverage, coverage through age 26. Employers will now have to cover dependents who don't have access to other employer-based health care coverage. Here's another one here: children covered for pre-existing conditions. For adults, that won't go into effect until 2014, but health insurers now will have to start covering children under 19 with pre-existing conditions. Here's the next one: insurers cannot rescind your coverage. As you know, and a lot of you have experienced this, unfortunately, there are insurers who try to take back your coverage when you get really sick, or they go to your original application and try to find some random error in there as an excuse to drop you. They'll no longer be allowed to do that. And here's another one: no lifetime limits. Insurers cannot put a dollar limit on essential benefits like hospital stays or expensive treatments. One more thing I'll show you now.
Okay.
Free preventive care. This is an interesting one because new plans are now required to cover certain preventive services like mammograms, colonoscopies, without charging anything. Any of those terms that health insurers come up with to make you pay stuff, deductibles, coinsurance, copays, you won't have to pay anything for some basic preventive care on top of obviously what you're already paying for that insurance plan.
Right. All right. So will this apply, what you've just outlined here, to all health care plans?
Actually, no, and that's really a good thing for us to talk about. Certain plans are actually grandfathered and avoid some of these changes.